The regard is needed, the trust is needed, otherwise the process doesn't work. But idealizing is someone when you accept everything and anything that's happening there. And this is something that I also experienced as a client with regard to my therapist. Now, why I wrote that post is because I realized that even though the therapist knows what they're talking about, even though we have that trust and regard and respect for our therapist, when you idealize someone, you basically accept everything and anything that they say and do, which might not always be true for yourself, right? Even if you're going to a doctor and they are giving you 15 minutes, like a medical doctor, and they're giving you 15 minutes. Sometimes you do feel that, I didn't get a chance to tell him all of my symptoms, or what he is understanding is not really close to my situation. And often the doctor calls you for various appointments, and they actually see that what they understood of your condition and how they prescribed you medicines are working for you or not. And then they ask you more, like, what new symptoms are you seeing? So basically, you are the one who knows the best for yourself. Similarly, in therapy, sometimes, because therapist is also not, therapist is also, he or she is also a human. So there are biases, and this is something where there's human to human interaction, right? So as much as therapists try to be objective and keep their biases, their dogmas, their beliefs and their feelings aside, it's inevitable that it comes into the process of therapy. And sometimes when we idealize our therapist, we stop also having this space that, I also know the best about myself, and here we are working together, I am also informing this process. When it just becomes one way, we kind of idealize the therapist, and whatever the therapist is saying, we consider it as something written in a book, right? Like it's a fact. And unfortunately, there are bad practices even in the field of psychotherapy. uh, always not in, it's not always intentional, but there are unethical practices as well. So the client needs to know what's happening with them and what's happening in the process. And when they idealize, they give all the power away to the therapist. What I mean by that post is just keep a little power with you as well, because you are the one who knows the best for what you have been experiencing and what serves you the best.